Okay, so welcome and thank you for joining us. This is a question and answer session with our students who received URICA undergraduate research internships and creative activities grants this last year. So they've been working on projects, and you all saw what they had to share with you about their current projects on Monday's convocation, but we're here to ask them a few questions and allow them to tell us a little bit more about what they've been working on. So thank you all for joining me here today. I will just say a couple things before we dive into the questions, a couple of clarifications that are maybe bigger picture that folks asked about. You all mentioned, you talked about the funding that you got. That funding is staying the same for this year, so it is $1,000 grant for those who receive URICA grants, which is great. We'll maybe ask you guys a little bit more about how you spent that, but it's a good chunk of money for, in many cases, research that you were going to do anyway. So. It's a $1,000 grant, and somebody asked about timing on that. The URICA committee at Bethel will announce a deadline. They haven't yet, but generally that's sometime in April. So if you're looking to do this, this is a great time to start talking to your advisor, start thinking about it, but that deadline for a proposal will likely come in April this next spring. So look out for that. It's a good thing to apply for, as I think you all sound like you could attest. So let's jump into some questions specifically about your projects. I think I have at least one question directed toward each of you, so I will ask you all some things individually. Winter, let's start with you. Your project is a really interesting one. A couple quick questions on that. One question was, what got you interested in dog saliva in particular, and does research support dog saliva to have stronger microbial properties than other animals like cats, for instance?
Okay, well, what got me really interested into my project was because after Bethel, I'm planning to leave for vet school, and I wanted to be a vet since I was about 4 years old, and dogs happen to be my favorite animal. So I kind of wanted to put those two things together, and since I work in an animal hospital, I'm literally around dogs every single day, and I was like, well, I should take advantage of this and kind of incorporate it into my senior project. So that's kind of why I picked the canine saliva part of it. And then for the research part, there hasn't been much research published that's been done over this topic, which kind of made it kind of hard. And I was like, do I want to do this project? Because there's not much to back it up. But there's been one study that's been done and published, and they chose dogs because most times the dogs are larger than cats. So the production of saliva is in a greater amount in dogs than it is for cats. So no study that I have seen so far in my lit review and everything have focused on cats. It's all been dogs. So I was like, okay, it's been done before, so maybe I can just replicate that, and dogs are my favorite animals, so why not? So that's kind of why I chose the dog as my recipients for my project.
One follow-up question then, Winter. What are possible applications of this research? Where do we go with this if you find out that it does have strong antimicrobial properties?
Well, for me, I guess I kind of was just wanting to prove that because growing up, I've always had dogs. And for me personally, growing up, when I have gotten scraped or something, dogs always want to go and they want to smell you out and see what's going on. And for incisions or scrapes or anything, they really are interested in that. And I was like, I wonder why that is. That's really disgusting. Why would you want to lick something that's bloody? That's just nasty. And so I was kind of interested in that. And growing up, I was like, why do my dogs want to do that? And then when it comes to them and say they get hurt, they instantly go and try to lick whatever, whether it's itching or it's an open wound. And I was kind of interested in seeing why that is. And through the research, I have seen that it's because the saliva itself has a healing agent in it. That's why dogs, when they get hurt, they reach back and they want to lick. Although it can cause irritation and all of that, it's still, I thought that's really cool. Your saliva can kill you, it can renew you. So I thought that was pretty cool. So that's the research. I kind of just wanted to again, just do another study that kind of proves that, because a lot of people will say ew, no, dog saliva, dogs have the nastiest mouth ever, but that's not true. They really have cleaner mouths than humans. Whether they eat their own feces or whatever they do, they still have cleaner mouths, because I believe that their mouths have a lot of antimicrobial properties in it. So that's kind of what my project is focused on proving.
Interesting. Thank you so much, Winter.
You're welcome.
Madeline, a question for you. How would you design a study for college students to study mastery motivation? And what would be the challenges to studying college students as compared to students on this topic? Or
Yeah.
young children, I guess.
Yeah, so honestly, I am not exactly sure how I'd go about studying college students because with preschool age children, it's really easy to trick them and say that a task is possible. With college students, they could use their reasoning and say, okay, this task is obviously not possible, I'm not going to do it. So that's mainly why I chose preschool age children, just because the task would be a lot easier to formulate in their case. For college students, I think it would have to be something more along the lines of like a brain game or something that they would have to really think about, or something with cards. I'm not exactly sure how I would even go about doing that, but there were obvious advantages to choosing preschool age children for those reasons.
Were there, one follow-up, were there challenges related to getting approval to work with children?
Yeah, so actually there was limited challenges. I haven't submitted my IRB yet, but I'm pretty sure it's going to be an exempt review, which is just like the quickest one that involves little speculation. But I have been in contact with a preschool teacher who's actually very willing to let me observe her kids. The only challenge that I'm facing now is with COVID, the preschool's online. So that will obviously limit my observations to a screen, and that will definitely hinder the data, but I'm trying to figure out ways around it, or maybe an alternative so I can actually see them in person.
Interesting. Interesting. And if we have time, maybe I'll ask a little bit more about attachment theory and where you came from that, but good. Excellent. Adam, I have a question for you. A couple questions for you. You mentioned something about this project relating to social justice issues. Can you expand on that a little bit?
Yeah, so my project, it kind of looks at where we are as a society right now, and kind of delves into, okay, what would happen if we keep on going down some of the paths that we go down. And so some of my paintings address issues like sexual violence, gun violence, racial violence, migratory issues. And so I just like wanted to highlight those and point those out, and kind of emphasize that those are problems that we have in our society right now, and yeah, that they need to be looked at and need to be treated as the issues that they really are, because I think sometimes those issues get gaslighted or not really, focused on or paid attention to as much as they should.
One other question for you, Adam, though this could be a question for anybody, but somebody pointed this toward you specifically. Adam, what did you use the URICA money for? Are art supplies expensive?
Yeah, so I bought 10 3x4 foot canvases, and I think 2 2x4 canvases, and those cost like around $750. So most of my money went to canvases, and then a few went to paints as well. I use paints that are about this big, oil paints, and those usually go around for $20 each too. And so, yeah, most of that money just went straight to art supplies, especially canvases.
That's why it's important to fund the arts, right?
Yes, exactly.
So I'd be happy to hear, some of you mentioned in your presentations a little bit about how you spent the money. Just to clarify for anybody who's out there thinking about doing this, there's absolutely you don't need to justify how you spend the money. I think it's interesting to hear, but you don't have to spend all $1,000 on your project. Some people have more expenses than others. It could just fund the fact that you're not doing a job at the moment, and that's great too. But did anybody else find particular expenses popping up that was useful to have?
I would say that in psychology research specifically, it's helpful to compensate your participants, because sometimes the questions could be more invasive, or you could feel like psychological distress after a certain study. I didn't do that. I didn't compensate my participants. I won't be. I simply used it, like you said, in place of a job, so I could work on the research instead, but I know that's helpful for some psychological experiments.
Good. Any other interesting uses of your Eureka funding from Winter or Elena?
I guess for me, since I'm a commuter and I live in Wichita, I kind of use some of my money for like gas money, because I was gonna have to come up here way more often than normal, like outside of school hours, to get my project done. And I guess another way that I kind of used the money was just to get myself out there, and I went like to like big farm animal vets, and I went and experienced with them. So that kind of course, like took gas money, of course, to go there. Like I went to some in Oklahoma and some in Texas, just to kind of get more experience with like vets. So I kind of use mine for that.
Good. Elena, I have a couple questions for you as well, but any thoughts on that question?
I used my money to compensate myself for not working. I usually work at a dental office most days in the summer, so I took about a month off to work on my Eureka project and some other studying and school stuff, but just took a full month off to get started on my Eureka project.
Good. Elena, and also an interesting topic. Can you say more about challenges or struggles of assessing real life anxiety in a lab setting?
Sure. With psychology research and the abilities that we have as undergraduate students, a lot of times our psychology research is through surveys. So the data that we're collecting is based on people's perceptions of whatever they're seeing, whatever they're feeling, and it's a lot of like self-report data. So I can ask somebody, how anxious are you? How are you feeling? How does this behavior by the dentist make you feel? But it's hard to imagine yourself in a dental office if your anxiety is lower. It would be really cool if I could get somebody in a room and then like put on those VR glasses and like really, or even take them to a dental office and then like assess their anxiety that way. But those are some of the limitations through research here. Is it's a self-report measure.
And then one more question about sort of your career goals and how that lines up with this research. What kind of, I didn't catch what you found in terms of hypotheses so far. How do you see yourself applying this to your hypothetical life as a dentist?
Right, so I'm still working on some of my hypotheses, and I'm hoping that some of Bethel students can take my study, so I'm not planning on releasing all of those. But as far as this study helping me, I think that there can be a really holistic view to dentistry, and you're treating the patient's mouth, but I think it's also important to acknowledge that your patients have different levels of anxiety, and it's really important to make sure that your patient feels comfortable when they're in your dental chair. So a lot of my study is analyzing the relationship and interactions between the dentist and the patient. So I guess one of my goals is to identify behaviors and language that patients are most comfortable with, so that I can use that in my dental practice someday to make sure that my patients are as comfortable as possible before we start treatment.
Thank you. I have one more sort of general question for everybody. Well, I'm gonna reframe this a little bit. Somebody asked about whether this needs to be a senior project, whether it needs to be related to your major. There were a couple questions about that. It sounds like you're all doing projects related to your majors. Are all of these senior projects, senior theses? Cool. So I'm going to ask you to flip this a little bit, because the answer is no, it doesn't need to be related to your senior project. A lot of people do that because it's convenient. But if you had to study one thing that has nothing to do with your major, maybe a different class you've taken, a different project you could take on, if you had to do it again and you could get another $1,000 for a totally different topic, what would you do?
So I will add also that I'm technically a natural sciences major, so I guess psychology does fit within that umbrella, but it is kind of straying from the typical biology chemistry that you see from natural sciences. So it doesn't necessarily have to be related to your major, even if it is your senior thesis project. But a study that I would do, would be challenging for me personally because I'm very much a science person, but I would like to look into gender studies and maybe examine some literature or some history and see how gender studies have played out within a certain century or even a certain decade, something along those lines.
Awesome, thank you. Other thoughts? Anybody have anything they think is really cool?
I definitely have a lot of topics that I'm interested in. So if anybody finds out that the URICA committee is just like passing out even more money for more projects every year, definitely let me know. But one of the things that I had considered, so I'm also a natural science major, so my undergraduate studies are pretty broad, but I think it would be really interesting to look at dental anxiety more biologically instead of psychology related. So maybe look at like changes in cortisol levels. So something where patients come in and then you take a saliva sample and analyze anxiety that way, and then maybe compare the self-report measures to the biological measurements.
All teeth though, definitely sticking with dentistry.
Probably
Okay.
still dentistry.
Winter or Adam, I'd be curious, you don't have to, but if you have a thought.
I'm also a history minor, so maybe doing something along the lines of some history research or some implications of like biblical history research too. That'd be fun, I think.
For me, I would have to say, it kind of would be out of my realm, but I would like to see like how different coaching styles has on like depression and anxiety of athletes and like all the pressure that's put on them. I'd kind of want to see that from like different sports angles and just kind of see how that affects an athlete the way a coach coaches.
That's great. So those are some free ideas for folks who are looking for URICA proposals for next year, I guess. Great. Any other questions or comments you all want to make to your classmates before we wrap this up? I know several of you gave a pretty good pitch for URICA already, so I won't belabor that point. Thank you all so much for joining me today, and enjoy the rest of your semester.